So far, it looks like we have a lot of participants where this is their first year hearing about the campaign. Looks like over 40% of you. And we have about a third of you who are advocates for children's mental health. About 20% who have participated as a community champion, and about 15% so far who have participated as a school champion in the past. Okay, I guess we'll let this go just a few more seconds, give everyone a chance to weigh in. Okay, so yeah, it looks like for a lot of you, 44%, this is your first year hearing about the campaign. About 6% are current campaign partners. 16% have participated as a school champion. 20% have participated as a community champion. And 30% are advocates for children's mental health. So that's great. Thank you so much for sharing that information today. And I will share out those results. I think everyone can see those now. Is that how that works? Okay, thank you so much. So just a few housekeeping details to go over today, just to let you know. Please mute your microphone when not speaking. The session today is being recorded and live streamed on Facebook. And we are very happy to make available to you the slides from today, as well as the recording, and that will be available online and also emailed to everyone who has registered for today's meeting. Throughout the meeting, if you have questions, please type them into the chat box. We will have a Q&A session in the middle of our presentation and then again at the end. And a final housekeeping thing to mention is that we will be sending out a survey about today's meeting that will be sent to you later this week, and we would really appreciate it if you could take a peek at that and complete it for us so we can get your feedback on today's event. So again, good afternoon, everyone. My name is Tara Wetherell. I'm the Social Marketing and Outreach Manager at Maryland Coalition of Families, and we are one of the very proud co-sponsors of the campaign. And now I will let my partner introduce herself, Tiffany.
Good afternoon, everyone. I'm Tiffany Thomas. I'm the Program Manager of Education Outreach at the Mental Health Association and also one of the co-coordinators of the campaign. We're so glad that each of you are here today, and we're looking forward to spending the next hour with you.
So we also want to say a big thank you to all of our campaign partners who are so important in spreading the message and the activities of the campaign. We want to thank the Maryland State Department of Education, the Maryland Department of Health, the Maryland Department of Disabilities, MANSEF, which is the Maryland Association for Non-Public Special Education Facilities, the National Center for School Mental Health, and Maryland BHIP. And Tiffany, you might have to remind me what the letters of BHIP stand for.
BHIP stands for the Maryland Behavioral Health Integration and Pediatric Primary Care. That space bar went a little crazy on me, so apologize for that, everybody. So we're really glad,
Tiffany.
No problem. We're really glad that everyone's here today, and it's no surprise to anyone that's here that children's mental health has really undergone a lot of pressure and a lot of change in the last couple of years due to the pandemic. And so we wanted to share some information with everyone here today and talk about why now and what's the urgency. So children's mental health is more critical now than ever. And in October, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association came together and declared a national emergency in child and adolescent mental health. The declaration stated that the pandemic has struck at the safety and stability of families. More than 140,000 children in the United States have lost a primary and or secondary caregiver, with youth of color disproportionately impacted. We are caring for young people with soaring rates of depression, anxiety, trauma, loneliness, and suicidality that will have lasting impacts on them, their family, and communities. The statistic that we have shared for years has been that 1 in 5 children are impacted by a mental health condition. And due to the pandemic, during the pandemic, there was a 20% increase in children and youth facing mental health and substance use conditions. So the children and youth and their families are experiencing this surge of the impact of what COVID-19 has done to their families due to many conditions. And so we're facing this all now, and there's so many things that we can do to contribute to making a difference in their lives. Next, the Child Mind Institute released a report this year that states that due to the pandemic, about 70% of both children and adults have reported some degree of mental discomfort resulting in loneliness, irritability, or fidgetiness. And of those children, 55% of them have felt more sad, depressed, or unhappy versus 25% of adults. So by equipping adults with resources and improve understanding, we have an opportunity to change the trajectory of children's lives. So now I'd like to take just a minute to show you a video from some of our past champions who have participated in the campaign. I had the opportunity to interview them over the summer and ask them what are some of the current trends in mental health for children and youth that they have worked with or they themselves have experienced and been around. And I'd like for you to hear from them yourselves.
Anxiety. Yeah, so I would say that top, definitely. And then, I think just adjusting back to the real world, quote unquote, after a pandemic, and having all the same stress, even more that they did prior.
Support. The kids, some of them haven't been in school for 18 months, especially at the secondary level. We're seeing a lot of anxiety, a lot of depression, a lot of isolation. Kids don't know how to socialize now because they've not been around anybody.
Balance, I would say, taking on too much and not practicing that self-care that we always preach, or not really having that balance in all aspects of their lives. And then when we get to the point where, we have hit our max, we crash and we don't know how to pick ourselves back up from there. And that is the point where we have to reach out to those resources when we could have prevented it before, taking those preventative measures, taking 5 minutes in our day and just checking in with how we feel and feeling our feelings, and, reaching out to those resources before we hit that point where it's too much.
So I'd like to take a minute to introduce our guest speaker. Today we have Dr. Jill Bohnenkamp, who is an assistant professor and core faculty at the National Center for School Mental Health within the Division of Child and Adolescent Psychiatry at the University of Maryland. School of Medicine. She has an extensive experience in school mental health research and policy and clinical practice at the local and state national levels. She has also worked with individual school personnel, district, and state national leaders to advance high quality school mental health. She builds on multiple years of direct clinical experience as school mental health clinician in urban, suburban, and rural school districts to inform her research and policy work. We're so glad to have you here today, and we look forward to hearing from you.
Thank you so much, Tiffany, and hello, everyone. I am thrilled to be with you all today and to be kicking off the 2022 Children's Mental Health Matters campaign. So I'm going to go ahead and pull some slides up on screen here. Just give me a second to get those up. Of course, it takes me a second to get into presentation mode. Just bear with me for a moment. All right, y'all can see my slides okay. I'll look for a thumbs up from Tara. Okay, great. So hi, everyone. Thank you, Tiffany, for that wonderful and kind introduction. I'm Jill Bohnenkamp. I'm core faculty at the National Center for School Mental Health. And I'm just so thrilled to be here and thankful that all of you are here to join us to champion these efforts. And we have this opportunity to make a historic difference. So for folks who aren't familiar with our National Center, I'll share just a little bit about it to get started. We're at the University of Maryland School of Medicine, and we're funded in part by the Health Resources and Services Administration to lead the National Quality Initiative focused on comprehensive school mental health services. Our mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. And we focus on advancing school mental health research, training, policy, and practice at the local, state, and national federal levels. And we also operate a community partnered school mental health organization, as many folks know, providing mental health supports to students through several counties in Maryland. Our National Center is co-directed by Drs. Sharon Hoover and Nancy Lieber. And as I mentioned, I'm a core faculty and a clinical and school psychologist by training. And we are so thrilled at the National Center to partner in the campaign. We've been a part of the campaign and partners on the campaign for many years, and just see this as such a critical effort in Maryland in our work to advance children's mental health. So at the National Center for School Mental Health and as part of the University of Maryland School of Medicine, we're committed to conducting all of our work through a social justice lens. We will continue our work to support culturally responsive and equitable practices in school mental health with a specific focus on Black, Indigenous, and people of color. And we recognize that through addressing structural and systemic inequities long present in education and mental health systems, school mental health systems have opportunities to develop and model equitable and anti-racist policies and practices. And we are committed to learning, healing, and growing together. And as we think about this year's campaign, we want to make sure that everything we do is grounded in this commitment. And so to get us started and to ground us in the importance of this 2022 Children's Mental Health Matters campaign. So many of you who are here are our true champions. You have been doing this work for years. You have been a part of the campaign. And as we saw in the poll, we are so thrilled to have so many folks who this is your first time joining us, really recognizing this important need, likely doing this work in your own communities, and now joining this effort going on in Maryland. So thank you to everyone who has joined us before and joining us for the first time. And I can imagine that many of you are here because you work with youth day in and day out and are dedicated to ensuring that all youth are safe and supported and able to reach their full potential. And this campaign is such a critical part of helping us to achieve that mission. So thank you to Tiffany for sharing some of our national picture when we think about children's mental health. And This article is from the Washington Post, and it came out in January of last year and resonated with me. So to quote it here, mental health is a simmering crisis for many of the nation's school children, increasingly evident in the distress of parents, the worries of counselors, and an early body of research. And I can imagine for many of you, we had this similar evidence and continue to have in our experience as educators, mental health professionals, researchers, and caregivers. And in the context of tremendous stress, loss, and community and family burden, it's not surprising that we would see an impact on young people's mental health. We know that these impacts cut across all communities and may be most impacting communities hardest hit by COVID, including our communities of color and those with inequitable access to healthcare and education resources. And even as we begin to come out of this dark time, the after effects are great. We have to consider a developmental perspective when we think about this. That a year or 18 months spent this way as adults is much different than a year of key development. And what would it have meant to spend your kindergarten or 6th grade or 9th grade or 12th grade year altered in such a significant way? We also have mounting data indicating that young people are in fact experiencing negative mental health impacts. We saw that 1 in 4 statistic, a 20% increase from their 1 in 5. We've seen that emergency department visits for mental health concerns are up for children and adolescents, and that about a quarter of parents report that their children's mental health is worse than before the pandemic. And I'll just highlight that these experiences aren't over, that the impact of the pandemic on development will have lasting impact for years to come. And so this is why it's so imperative that we are intentional about addressing children's mental health now and in the future. And to share some additional statistics, and I share this knowing that many in the audience know these statistics and have heard these, and this is why you're here. This is why you're at this launch event and are dedicated to the Children's Mental Health Matters campaign. But I share these statistics because these are the types of things that through the campaign we will share broadly and make sure that folks hear us and most importantly have information to be able to act. And so when we look at numbers like this, 50% of high school students reporting moderate to extreme concerns about their mental health, or 62% of high school students reporting experiencing stress or dealing with anxiety. That's every other student or every other youth in middle and high school. And so it couldn't be more imperative than it is right now that we are really getting the word out and thinking about ways to make lasting and impactful change. So Tiffany shared that the AAP, AACAP, and CHA have just made this new declaration of a national emergency in children's and adolescent mental health. And this highlights for us this national picture that we know is happening in our communities here in Maryland, and just highlighting how this is important, and that our school communities and our pediatric communities are aware of this need, and that this is coming from our national organizations really highlighting this need for children and adolescents. And it's not just youth. We also know that parents are also under tremendous stress. So in the spring of 2020, about 3,000 adults residing in the United States were surveyed, and findings revealed that over 70% of parents reported distance learning for children was a source of stress, in addition to these significant sources of stress, including basic needs, healthcare services, and missing major milestones. I know that many of you work in schools, and I will just highlight that this national picture of adults who are interacting with youth on a daily basis. So again, when we're thinking about this Every other teacher working in our school buildings, right, I have reported 52% of teachers say that their mental health has declined during the global pandemic. And so it's so critical that we're aware of these numbers, that we're able to share these, right? I know the folks that are on this call are aware of this impact. That's why you're here championing this, but we share these statistics and we'll continue to share them through additional resources that are a part of the campaign, so you can get the word out to your communities about just why this is so critical that we're addressing children's mental health and addressing these extreme needs right now. So given this well-documented impact of COVID on the well-being of our youth, families, and educators, where do we go from here? How do we address issues of anxiety, fear, loss, and equity experienced by our entire communities, extreme stress and burnout, while simultaneously fostering hope and resilience in our communities? And this is an opportunity that we've never had before. So the way that our communities are talking about mental health, are aware about mental health, is very different than in the past. And you may have noticed this in your own setting, that it may have just been champions in the past that were saying we need to be addressing, we need to be thinking about children's mental health. But now more than ever, we really have this huge awareness of our need to address children's mental health and a desire to do that. In one survey from the Child Mind Institute, I always look at our teens and our youth as our inspiration. And so in one survey from the Child Mind Institute, teens reported being optimistic. While they have experienced and reported this ongoing increased mental health distress, they report that 67% agreed with this statement. I am hopeful that I will adapt and rebound from the challenges of the pandemic. And it's just so inspiring to hear that despite all of this, we have this opportunity, and we can't look to a better source for hope and resilience than our youth. And so if almost 70% of our youth are saying that we can do this, we absolutely can. This is a historic opportunity that we have in front of us. I just want to highlight that there are many recovery funds that are coming to states and districts in various formats. And it's not often that we can say we have the opportunity and funding to truly transform our systems and ensure that every single person has access to safe and supportive learning and working environments. This is the way we dream our schools and communities can be. What we build from recovery funds and from this momentum and from this awareness has the potential to have lasting impact for years to come. All right, so I know we have many mental health professionals that are in the audience and that are familiar with motivational interviewing. So I thought I'd pull out our stages of change from motivational interviewing as we think about the Children's Mental Health Matters campaign and how we are able to use this to really make that historic impact, to really change differences here. So I show this graphic because there are a lot of steps that happen before action. And so if we're thinking about how do we motivate individuals or organizations for change, we have to make sure that they even know about the issue. And given this focus on mental health, we know that many folks have moved out of our pre-contemplation stage, but still many folks may not know the full severity. And so thinking about how can we use the Children's Mental Health Matters campaign to share statistics, to bring this national emergency and awareness to folks in our communities. As we move down our stages of change, we have to make sure that we share persuasive information to help individuals when they are contemplating action. We have to make sure that they have the resources that they need to implement change. And the campaign is critical even in our action and maintenance stages. So many of us in this virtual room are dedicated mental health advocates. But I know for me, as one of those dedicated mental health advocates. This campaign inspires me of our potential for change and action, and that it's even more critical that we get in front of key decision makers about children's mental health when they have potential funds to support this work in a historic way. All right, so how does this Children's Mental Health Matters campaign work? For folks who are joining us for the first time, what are the ways that we see this working? So the Children's Mental Health Matters campaign allows us to get the word out. It allows us to engage key stakeholders and decision makers, share why this is so critical. It helps us to decrease stigma for our youth, for our families, for our schools, and for our communities, and it motivates people to action. The Children's Mental Health Matters campaign allows us to open doors to talk about children's mental health, share why this is so critical, and motivate people to action. All right, so I also want to share some of these example campaign successes, and I'm thrilled for many folks who are joining us who have participated in the campaign today, and you may hear some of your successes shared. So this is what we hear over the years in hearing just what the campaign is able to accomplish. We hear that following the campaign and as a result of the campaign, we're having more genuine conversations between teachers and students about how to support one another. We see more parents reaching out for help and following through with referrals. We see significant new children's mental health resources that come out of this. I heard about amazing things happening. Shout out to teams who were able to actually have resources to move forward with a new children's mental health unit, new resources happening in schools. And perhaps our most powerful is this empowering of our next generation, supporting our future and current change makers to learn and talk about mental health. And I'll also just highlight that the campaign helps us to change the narrative. When we think about the impact of the campaign on parents and educators and the resulting impact on our youth, we see that we are having more conversations like this. So instead of looking at a behavior and thinking, what is this problem? We're thinking, what might be the unmet needs that my student or youth or child is expressing through this behavior? How are system factors like racism, poverty, or school climate contributing to my student or child's behavior? And what can I do to reach out and respond to youth's needs? Our evidence base about reducing mental health stigma highlights that the simplest way to address mental health stigma in our communities is to start talking about mental health openly. And that's absolutely what this Children's Mental Health Matters campaign focuses on. So these open discussions are the first signs to youth that your classroom or community space, pediatric office is a safe space to discuss any mental health challenges they may be encountering. And you can show youth that you believe in the importance of mental health by dedicating space in your office, in your home, to really highlight and focus on health and wellness. And so I love these images of what this can look like, to be talking about mental health, to be promoting mental health, and have this happening in a really visual way. So those shout out boards that you saw and promoting mental health and many of these things that I've talked about around campaign successes, don't worry, you don't have to get these together on your own. You don't have to think about, oh, how am I going to put together this shout out? Well, you can, and you can definitely. We want you to be creative. We want you to think about resources that you have in a community, ideas that you have been wanting to move forward, and this is an opportunity. But we also will be getting you started with a Children's Mental Health Matters toolkit, and we'll share more about this in our launch today, and you'll hear more as the campaign goes on. But this is an amazing resource that gives you things that you can pull right out of this digital toolkit, flyers, essay contests, social media graphics, email signature templates, sample newsletter and blog posts, morning announcements, phone messages, and social media posts, just to name a few, that allow you to, we want to make your jobs easier. We're so glad that you're willing to partner with us on the Children's Mental Health Matters campaign. And there are lots of ways that you can move this forward in your community. And you can see it's maybe hard to see some of this particular, but here are just some ideas around how you can be a champion. You can share resources about the campaign and information about the campaign with your network. You can host events. It doesn't matter the size, right? No campaign event is too small. So whatever you feel like you can do in your community. And I'll share here some of these amazing successes, right? So thank you to those who were willing to share their actions from last year and from previous years. And I just get so excited seeing these in action. And it really just highlights the potential impact, right? So when we see these kids in these classrooms talking about children's mental health and seeing and getting excited about this and learning about this, we know that there's just an exponential effect. And so we have opportunities to promote children's mental health, to promote the campaign via individuals, via our classrooms, via families. We have this impact that can happen at the individual student, family, and teacher level. And we have the opportunity to really bolster our resources for our schools and community. And I urge you, as you're thinking about this, to not forget about COVID relief funds and the potential possibilities we have here. This combination of awareness about the mental health crisis and the historic opportunity of folks being willing to hear this message and our opportunity with relief funding makes this likely one of the most important campaigns to date. And so what are you going to do with this opportunity? What have you wished to be doing in your community? What do you think will move your community forward? And so I hope that you walk away from this meeting today with at least one action step that you'll be doing to move this forward and to be a children's mental health champion. So thanks so much for the opportunity to be here today. Please know that I'll be doing the same thing, writing down my action steps to move this forward. I'm so thrilled to be partnering with you all and happy to answer any questions that folks may have about any of the information I shared. And then of course, we'll hear more from our campaign leaders about next steps.
Thank you so much, Dr. Bohnenkamp. And so before we move ahead and start talking about more details about the campaign, we just want to take a few minutes and open up the floor for questions. If any of you have questions for Dr. Bohnenkamp, please just go ahead and type those into the chat and she will be happy to address those for you.
And I'm happy to keep monitoring the Q&A or questions that come through in the chat. So please feel free to put any of those in there. And thank you again for the opportunity to be here today and thrilled to be partnering with all of you as we kick off the campaign.
There is one in the chat box. I don't know if you want to answer it privately or not. And if you want to answer any of the ones that are coming in to the chat and Q&A.
Yeah.
So move ahead, that would be great.
Yeah, this is like, sure, I'm happy to do that. Yep, sounds
awesome.
Good.
Thank you. So we're going to go ahead and keep moving along so that everyone can learn about how they can get involved with the campaign today. So for those of you that are new, there are quite a few folks that are new here today. We're going to talk a little bit about the history of the campaign. The initiative is a collaboration of two organizations, the Mental Health Association of Maryland, which is the organization that I work for, and the Maryland Coalition of Families, which is where Tara works at. And we get support from the Maryland Department of Health, the Behavioral Health Administration. So for more than 20 years, the campaign has been doing work across the state of Maryland, and we bring together our partners, which we mentioned earlier, schools and nonprofits and other organizations across the state to work on the following goals. We increase public awareness of the importance of children's mental health and substance use, reduce stigma surrounding mental health, connect children and families with resources for prevention and support of mental health conditions, highlight creative and innovative efforts of local communities in Maryland, and provide opportunities for all campaign partners and champions to be a role model. So what are some ways that you can improve children's mental health in your community? And what a lot of people are familiar with are to become a champion. Each year we ask schools across Maryland and community organizations to join the campaign as a champion for children's mental health. And we focus on that participation during our annual awareness week. We provide those champions with a digital toolkit, which is what Dr. Bohnenkamp referred to during her presentation, which is full of ideas on how to increase awareness of the importance of children's health within their communities and encourage them to partner with others to promote their local efforts. There are champions all across the state who partner with organizations in their community to increase engagement in their local cities. There are lots of examples of that from last year that you can find on our social media in our wrap-up report from last year. Each champion that participates is spotlighted on our website and is invited to be nominated for Champion of the Year for their creative and innovative awareness efforts. We are launching our sign-up forms for school and community champions today, and the links for signups will be dropped into the chat now. So you can go to our website and sign up as a school or community champion starting today. And we invite you to do so. Another way that you can improve children's mental health in your community is to share our resources. We have a wealth of resources available on our website that are available for digital download or can be ordered in a physical copy free of charge. They can be shared via email, can be shared on social media, or can be available physically in your schools or offices and more. You can access that with the link that will be dropped in your chat now. We did add a Spanish version of our entire family resource kit this year. So that is available now. You can download the entire kit or specific fact sheets that you would like to pull from that. Those are available on the downloads page there. And as a champion, you can participate in Awareness Week, which in 2022 will be May 1st through the 7th. Our partners and champions will elevate the importance of children's mental health in their local communities during Awareness Week. If you aren't able to participate as a champion, we encourage you to get involved and in little ways as well and join the excitement during Awareness Week. So you can follow the campaign on social media platforms and see what's going on across the state and in local communities, and to reshare posts and reshare photos and do the little things that you can to increase awareness of children's mental health. Some of you aren't familiar with where resources can be found, and we'll drop the link again where you can find them. So the first place that you can find resources related to children's mental health is on our website, on our resources page, which is going to be dropped again into the chat. You would go to our website, which is childrensmentalhealthmatters.org. And if you can see this, there are a couple toolbars at the top, and you would go to the resources tab, and then you can go to downloads, and all of our resources are sorted by category on that page. Another location that you can find resources specifically for our champions that are involved are underneath Get Involved, and there is a tab for champion materials, and you can find those there. There are resources available in Spanish. Not all are available in Spanish, but some. And like I said, all are free, downloadable, printable, and updated throughout the entire campaign season. Another place that you can find resources about mental health from birth through adults is our Mental Health Association website. We have free publications, resources, and training, information about mental health first aid. And what we do is advocacy and public policy work addressing behavioral health in Maryland. And the Maryland Coalition of Families website, which is mdcoalition.org, they offer family peer support, which are specialists who offer support to children and families through lived experience. And they have support groups, events, and webinars. And all that information can be found on their website as well. That is a great tool for children and families across the state. So I'm going to launch another poll here for you. And we'd like to know, in years past, what campaign resources have been most helpful in your community to meet the goals of your efforts, if you've participated before. I do apologize if there's something that you've used and loved that's not on here. There wasn't an other option. You can drop that in the chat if you would like. And these are our resources, not our campaign awareness giveaways. These are our resources that share information, not our giveaway items. I'm going to go ahead and in that poll, a lot of people have answered. Share the results. That Champion Digital Toolkit and our Family Resource Kit and Mental Health Activity Sheet seem to be the most popular. So just so everyone's aware, our Family Resource Kit was recently updated this year with new links and new language and new information. So all of that is relevant to this year. And like I said, it has been translated to completely in Spanish this year. So that is a new resource for you. Our Champion Digital Kit will be available for folks later this month. So you'll be able to access that on our website later this month after you sign up. And a lot of these resources will be updated throughout the campaign year for you. And any changes that we make and additions we make, you'll be updated on throughout the year via email. Thank you for participating in that poll. Like I said, resources still to come. A 2022 Champion Digital Resource Kit. We have a complete partner media kit. Once you sign up, you'll get a confirmation page and a link, and we have added some partner media kit tools to our website. That includes a badge for you to print off and even put on your door, or add to your email signature line, and some graphics that you can use and share on social media. We will have a PowerPoint presentation for you to use for presentations if you would like to do that. And some other items we'll be adding throughout the year. We're working on updated book lists for older and younger children, updated mental health activity sheets, and more. And like I said, you'll receive ongoing updates as resources are updated. So some important dates for you to note. We are having 2 more launch meetings this year. So we are having a winter launch meeting on Tuesday, January 25th. At that meeting, you'll have an opportunity to hear from past champions about their past successes and efforts. So that's an opportunity for you to take notes about some ideas to maybe use as a brainstorming opportunity to do in your community if you just need some ideas about what to do. And you'll learn about new resources that we have and some plans for the spring. And during our spring launch meeting, which is scheduled for Tuesday, April 5th, we'll go over how to use our resources for success in your community, share some events that are planned, and build excitement for Awareness Week. And like I mentioned before, Awareness Week is scheduled for May 1st through the 7th next year. So in the next slide, I have a video for you all to hear from our past champions about why you should get involved with the Children's Mental Health Matters campaign.
We need you. Primarily. The more people we have to push out how important mental health is and what it is, like what it actually is, and everything that goes into it and things that can be done to help improve it in every aspect. Because of course, if we're talking about children, we have to talk about their families, because they're just like little innocent beings. They don't really know. And so we have to push the information out, get the people involved, and I think that's the best thing that we can do.
Campaign is absolutely amazing. The campaign has always, and this has only been 2 years that I have been involved in it, but the campaign has provided pretty much every resource that you could possibly need. It's more of, bringing awareness to your community and to your schools and trying to erase the stigma so kids know it's okay to reach out for help if you need help. It's just a great experience. I mean, the week is very busy, but it's so much fun.
People should get involved in the campaign because we do this work each and every day. And it's an important week for us to celebrate the work that we do. Make sure, again, that families have the information available when a crisis might happen, or, just promoting at the most basic level children's mental health.
I strongly believe that other people should get involved in this campaign that is going on throughout the state, because you learn so much and you meet so many amazing people who are so educated around this topic, and you have a sense of fulfillment from participating in these events, not only because you are learning, but because I personally have felt it on such a deep level, the importance of the work that is being done.
I think others should get involved in the Children's Mental Health Campaign because we're increasing resiliency. We're just helping kids cope with life, and this is their future. So we want them to be prepared, mentally strong, and ready to handle all of life's stressors. So I think you should join the campaign because not only is it intrinsically so valuable, it impacts so much more than you can ever imagine.
So now's a time to take action. We invited everyone here today to learn about the current crisis in children's mental health and to learn about how you can get involved. And so now we'll offer some opportunities for you to take action. You can commit today to becoming a 2022 school or community champion. And we'll drop those links again for you in the chat. The separate links for school and community champion. You can help us by contributing creatively to the success of the campaign. You can schedule a call with me to talk about maybe offering a webinar or brainstorming other ideas for statewide contributions or a new resource that you think should be added. If you have any questions about the campaign before you make a commitment, you can schedule a call with me, and you can do that straight through a scheduling link that I have that's going to be dropped in the chat right now. You can share our resources that we have available on our website. share them within your school, share them with your community, share them with your faith community, share them on your social media platforms or with your friends. Have them available whenever you need them. You never know when you'll come across a child or a family that is in need of mental health resources. You can commit to participating in Awareness Week, and you can simply just follow us on our social media platforms. We'll share those links with you in just a second. So I'm gonna have a poll for you again. I'm gonna ask everybody, what is the action step that you are planning on making today? All right, thank you to everybody who answered. Here are the results. I appreciate everyone making a commitment to doing something to help raise awareness of children's mental health and to support children and families in Maryland. It's so important, given the place that we are in and that there are so many children that need support right now. So here are ways to stay in touch with us. We have dropped the links in the chat about the locations you can follow us on social media if you're not. On our website, you can sign up for newsletter updates as well. And if you have questions, you can reach out to me or Tara in an email. And like I said, we will be sending out slides and all of that later this week for you all who would like to view this or share it with others. I'm going to pass it back over to Tara.
So once again, as we wrap things up today, just a reminder that we will be sending out a survey about today's launch meeting, and we are very interested in getting your feedback on that. So when you get the recording of today's meeting, if you could just take a few minutes to fill out that survey, we would really appreciate it. Getting your feedback helps us know how we can help you. And we look forward to hopefully seeing all of you at future meetings. And now we'll take a few minutes to answer questions, and these can be for Dr. Bohnenkamp as well.
And I'll just say I was answering questions as quickly as I could in the chat. If I didn't get to your question, please don't hesitate to reach out to me. Or if I mentioned I have additional resources, please feel encouraged to email me. Really happy to support everyone's efforts.
There were a few questions about how someone would become a partner with the campaign. If that is something that you're interested in, please go ahead and either send me an email and I'll have Dina drop my email address in the chat again, or you can schedule a call with me to chat over Zoom. Dina, can you drop that link in the chat, that you can see my schedule and you can look at your, with your own schedule too. So that's something that you can do, and we can have a chat about that, learn more about your organization, and we can explain that process to you. We would love to partner with more organizations to support our efforts and connect with you. So please, if you're interested in becoming a partner, just connect with me sometime this week, and we can do that. Yes, Erica, you can also email me the link too from your intern. If there aren't any other questions, we really appreciate everybody joining us today. And we're really excited that there are so many of you, and really hope that you will help spread the word about the campaign and join in. And we thank you, Dr. Bohnenkamp, for being here today to share what you did, and your support from the National Center for School Mental Health as well. Thank you so much, everyone, and we'll be sending out an email later this week with follow-up information for you.